my dad died when I was 15. And so turning 30, there was something about that period where I just had this realization that in my 30th year, I would have spent more time alive without him than I had with him. And there was something very salient in that feeling to me. And it just got me thinking about everything else. And I also realized, well, wait a second. I mean, I was medicated so quickly after my dad died that also means that if I keep going down this path, I will have spent more than half of my life in my entire adult life on really powerful drugs. And I had not a single moment in my adult life that I could point to and say that was an unmedicated moment and this is who I am without. The internet was kind of, barely alive at that point. So it was just a different time. We very much, put all our faith in the one doctor in town, and their opinion was the one that we went with. And so what happened was I got taken to a child psychologist, and I met with this person for a few months. I severely disliked her for a variety of reasons, and I was a 15-year-old. And after about 2-3 months, she called my mom and said, what Brooke needs is a psychiatrist, not a psychologist. I'm diagnosing a depressive and anxiety disorder, and I recommend medication. And in a world of basically pre-internet, like, who are you going to listen to? So my mom listened to her, and we ended up in a psychiatrist's office, and then that's when all the prescription medications began for psychiatric drugs. And in retrospect, what we should have done was get a second opinion. But it was Reno, Nevada in 2001. There was not the availability then, and at that point we didn't have a reason to question the opinion. It was only later that we look at it and say, okay, maybe this really wasn't the right call. There seemed to be no real positive or negative on them, but it just was recommended that I keep taking them because they weren't supposed to hurt me. And so that just kind of kept happening. The problem was I turned 18 about 2 years later, and then the habit had been established. And so it was difficult for me at that point to see a reason to get off of them. And I was young, and my whole identity had been formed around this idea that I had been told that there was something wrong with my brain and that I was depressed and anxious. And so therefore, well, why wouldn't I take these pills that are for the thing that someone told me that was wrong with me when I was, when I was 15? I think it's just quite insidious how that happened, and how my identity became wrapped around that in a very, very subtle but significant way. All I kind of felt like I wanted at the time was to be left alone and have some time. And my grades I wasn't failing. I wasn't getting in with the wrong crowd. I wanted to be alone, and I was exhibiting maybe some mild eating disorder symptoms, but I was also a really serious ballet dancer. Not that that's a reason, but given the time and the place and the context, I think that the holistic situation wasn't really looked at. It was very much fear-based.
What was the aha moment? Because that's what we really want to know. When were you wait a second, what, can we do this differently? What was going on for you, and when was that?
So it was 15 years later, and I was right around my 30th birthday. Mm-hmm. And my dad died when I was 15. And so turning 30, there was something about that period where I just had this realization that in my 30th year, I would have spent more time alive without him than I had with him. And there was something very salient in that feeling to me. And it just got me thinking about everything else. And I also realized, well, wait a second. I mean, I was medicated so quickly after my dad died that also means that if I keep going down this path, I will have spent more than half of my life in my entire adult life on really powerful drugs. And I had not a single moment in my adult life that I could point to and say that was an unmedicated moment and this is who I am without these drugs. I had no frame of reference for that. And that was a really disorienting feeling. And then it was coupled by the fact that at this point I was starting to have suicidal thoughts and suicidal ideations. And it wasn't anything dramatic. I mean, I guess it could be dramatic, but it just felt normal. It came on slowly. it was just, it was this feeling of not wanting to be alive. And then it kind of intensified, for like the hows and the logistics of it all. But it wasn't like I woke up one day and I was having a psychotic break and threatening suicide, and it was really other people were involved. It was very slow. And it just dawned on me that if the antidepressants were working as advertised, then I wouldn't be having these thoughts and I wouldn't not want to live. Like, it just didn't make any sense. The math didn't add up. So I
pretty simple. Let me just interrupt. Pretty simple, but incredibly powerful and potentially life-saving to just connect those dots, right? Like, wait a second. This is a very simple concept, right? I have patients all the time. I mostly treat pain. I'm not in the mental health field, but I'm a physiatrist, which sounds like psychiatrist, but I'm very much sort of plugged into the mind-body connection because we have a lot of pain because of, mental issue. It's all related. We're one human being, right? Medicine is human science. But to just have that awareness, right? That sort of light bulb go off, like, well, wait a second, I'm taking these medications because I'm not supposed to be here, right? With these thoughts, right? That's huge.
My dad dies. I go on these antidepressants. Within about 6 months, my hair is falling out and I'm like having these Charlie horses, and like it all pointed to the hypothyroidism. But at that point, because it had been, and I had one test that showed a reduced thyroid out of like 3. The other ones were normal. So instead of someone looking at that and saying, okay, well, you also just went on these other powerful drugs 6 months ago, that could be a side effect. We no one, including me, including my mother, who is the most like, she's an angel put on this earth, right? Like, none of the 3 people on the team, me and my mother or the doctor, looked at a choice that had been made 6 months ago because of the trauma that had happened 9 months ago, right? Instead, all we saw was this one lab that said the thyroid was down on that day and that hour, and then I was put on drugs that I stayed on for the next, decade and a half. And that happens all the time, right? And like, one of my favorite words in the English language is iatrogenic, just because I think so many of our diagnoses and culture and, the body come from too small a view when we really need to zoom out. And so for me, when I was able to start like healing myself, if you will, from the thyroidism and this bile reflux disease and the nodular vasculitis, like I just realized how much more connected and how I mean, it sounds so pithy and cliche to say lifestyle choices, because it's not just about going for a walk, but that was like physically finding a way to live a life that resonated with who I am is how my health started to improve.
You were aligned with yourself. You weren't fighting yourself, which even energetically is not going to help. But I just want to define that word iatrogenic because it's a good one and not everybody knows what that is.
Yes.
So iatrogenic means healthcare caused, right? Doctor caused, pharmaceutical caused, things that happen in the healthcare system with, let me just say, with not bad intentions.
No, it's
the number, people don't know this, and it is shocking information, but the number 3, and I'm going to say it a couple of times maybe, or just emphatically, the number 3 cause of death in this country is due to medication or procedurally or doctor-induced errors. Now, this is not that, doctors have bad intentions or the pharmaceutical companies are not trying to sort of help people. However, we need to think for ourselves, just as you did, and ask the questions, which would have been super helpful at 15, but nobody's at fault here. And thank goodness you sort of had a little bit of an awakening and your life is now organized around this, which is super important to share with other people. Asking the questions, is there anything I can do for myself or anything that I can do maybe non-pharmacologically that could help me be healthier? Is there anything I could do for my thyroid disease? Is there anything I could do for my low mood? Is there anything I can do without side effects? Because once again, iatrogenic, that word, the number 3 cause of death behind cancer and cardiovascular disease is healthcare cause. Now, not to everybody, screaming, listening to this, but it is a super important, and by the way, MedShadow, who produces this podcast with me, that is their number one mission, to educate people about the risks and benefits and side effects of medical treatment, including pharmaceuticals, including surgeries, right? I have patients all the time. Oh, my doctor said I need back surgery. They didn't even examine them. They didn't even take a look at their range of motion, some very basic things. They're signed up for surgery. And I feel like a hockey goalie often as a physician, saving people from unnecessary procedures when we could really follow our oath of first do no harm. It sounds like you're on track and you're caring beautifully for your mental and your physical health and helping others get there as well. So mention your book again, please. Brooke, Siem, you have it? May cause side effects. Yeah.
May cause side effects, bright orange cover. It's hard to miss in a bookstore, but you should probably go if you find one. You should also probably take it out from wherever it is and generously put it on display in the front. It's a fun thing to do and I appreciate it. Yeah. But yeah, it came out a couple weeks ago. The audiobook should be out soon, and yeah, May Cause Side Effects, available wherever books are sold. You can also get it through Indigo in Canada, through Foils and a few other retailers in the UK, and Booktopia in Australia.